Some surgeons, and again, no disrespect to who they are, they do get additional training. But the biggest issue that I have is not that a doctor shouldn't do stuff that they don't know. It's only do things that you can fix. So if I'm doing your tummy tuck and I'm a psychiatrist, for example, and you start to bleed, I should know how to fix and stop the bleeding. If you don't do it. Part of the thing that we learned in training, for example, is we do general surgery training as plastic surgeons. That means it's whatever trauma, whatever stuff happens, right? And we talked about this a couple of weeks ago with Dr. Benjamin. That's something like if somebody gets shot in their lungs, they get what's called a pneumothorax. That's where air is actually outside of your lungs, but it's leaking from your lungs. So every time you breathe, air leaks out and causes your lungs to shrink. And it makes it hard to breathe. And here's the catch. You have to put a tube in between somebody's ribs to get that air out to allow the lungs to stretch back out. It's called a chest tube. You can't do a breast augmentation until you know how to do a chest tube. Because when you put an implant, if you don't know what you're doing, you're going to get into the lung and give somebody a pneumothorax, which could kill somebody. So if you don't know how to fix a problem, you shouldn't do the surgery.